We should be okay.
Back in business.
I'm loving that mask too.
Thank you. I made it.
All right. Before I continue the delegates,
Can I play with those toys in there?
can you tell us a little bit more about what are your main concerns about Cooper at this school?
He has some frequent outbursts at school and at home. Like, he doesn't want to do something, like he's hard to calm down and kind of like redirect and stay on task, and that's basically it.
Outbursts of anger, or
Say it one more time.
outbursts of anger, or
Yeah.
Okay.
Yeah, it's anger.
Can you give me an example of it?
Like what triggers it?
Yeah.
Cleaning up his toys or transitioning from like something he loves to do to something he doesn't want to do. I don't think his teacher is a right fit either, which I think is part of the problem. I've heard from other parents in her class, just like in the past week, that pulled their kids out of her class. So I think it's probably a little bit of that. Like, she doesn't want to go to school. So every morning we have to go through like, going to school, it's going to be a good day. We're going to listen, and I give him a pep talk, and it seems to help him a little bit. Masks are new at school, so that's been another struggle. I've always kind of thought he kind of had a disadvantage because when my daughter was born, I was overwhelmed with 2 kids. I didn't take him to do as much stuff as I did with her. And I stay home during the day, so they don't go to daycare. And then with COVID happening in the midst of all that when he was just 2, and I don't know, I just feel like he's kind of had a disadvantage of not being around other kids, which has caused some of this. So like, kids not sharing and him not sharing with kids, like it causes him to kind of have a freak out, So I don't know if it's all, just lack of experience on his part, because this is his first year of preschool. He'll do another year of preschool next year before kindergarten. So
What did your concerns about these outbursts and these behaviors started when he started preschool? And prior to that, he was okay?
no. Can you put it back on?
Wait, I have to drink.
Okay. Put it back on after you take a drink then. He's pretty good with me. It seems like he has more outbursts when we're like out and he's not expecting what's going to happen. I don't know if that makes sense. I don't know. He has to really be like, for example, we started him with soccer. He's been talking about wanting to start soccer. It's a mess. He's all over the place. He doesn't like stay in line like the other kids. Like all the other kids are listening, and he's literally like running around the field, like completely oblivious to what he should be doing. But this is the first team thing he's ever done. So, I don't know if it's just like he's got to get used to things where he has an issue. So that's kind of where we're at.
Yeah. And going back to your history and his history, you were saying that no complications besides coming a little bit earlier.
Yeah.
He didn't stay longer in the hospital. He didn't require any kind of
NICU, nothing.
All right.
He was big for being almost a month early. He was 6 pounds 6 ounces, which was almost a pound bigger than my daughter at full term. So he was normal and good, and yeah, we didn't have to stay anywhere. He did end up getting a plagiocephaly, so he had a helmet when he was 4 months old, just for like 10 weeks. So it wasn't too bad.
Like his heart and his hearing is created, and all of that was completely normal.
Yeah, everything.
Any medications that he's taking?
He's just on an antibiotic right now because he keeps getting ear infections. So he has bad, I say he has bad ears because he has a constant ear infection. He's already had 1 set of tubes, and he's 1 ear infection away from another set. So, yeah.
And then any allergies? In any prior evaluations that he showed this concern?
No,
No, this is the first time that he's being evaluated. So,
yeah.
Any past
Such a
surveys?
pass puppy.
Those tubes.
Nothing else?
Nope, nothing else.
Okay. And then regarding social care,
Let
tell
go.
me a little bit more who's in the
What do
home.
you do?
It's
Oh,
me, his dad, and his sister,
Okay.
which I also think is like, I don't know anything, but his older sister's autistic, diagnosed autistic. So she doesn't always handle her emotions appropriately. So that's all he's known and been around. So I
where's the
don't
O?
know.
Oh, you know a lot. Because you are the one.
That's
with
right.
him and
Oh.
and we appreciate all the information you're giving us.
Yeah,
You know more than what you think.
yeah, I know. Well, sometimes it's like, is that important? Is it not important? I don't know. So.
It is.
Yeah.
And then, anyone else involved in his like care, anything that has changed in the home recently, besides him going to preschool?
No,
No.
no, nothing.
And
Here, Cooper.
Wait, I'm not done yet.
No, you're done. Come here.
any recently family stresses, I know the pandemic has been big and
I wanna
all
drink
that,
one a
but
little
besides that, anything else going on at home that is been COVID affected these behaviors?
No.
Any history of trauma in the family or him?
No.
No. Okay. When we talked about your concerns, I know that is not here right now.
No.
But if I was to ask him about, his concerns about her, do you think he will be the same? Or are there any other things that he usually points out?
No. I think his biggest concern now is like, he's really frustrated with how he is at soccer and, because that's all he's seen. He's not with me with the school stuff and in contact with school. So, that's like his biggest thing. And
That's it. Thank you.
yeah,
Regarding education, you mentioned he's in preschool right
Yes.
now. You didn't accommodate him before.
no,
Okay, and another do little tasks, it's hard to judge academically how they're doing while he's in preschool. You mentioned the teachers. Can you tell me a little bit more of what they said and what the teachers' concerns have been?
well, the teacher, so I get a daily paper home every day that says like what they did, which is like pre-filled out. And then at the bottom, she has like, my mood today was great, just okay, or fine. And she'll kind of like write a little note. I get a lot of great and good, but then when I do like a conference with her, she's like, oh, he has frequent meltdowns. And I'm like, I'm confused because you're telling me he's great or fine. He's 4. He's going to have a it's like hard to distinguish. Is it a normal 4-year-old not getting their way, or is it,
Am I looking at your table?
So I'm confused on the communication
Wait.
with her
The table.
because I had such a great experience at the same school with my daughter with a different teacher that I just feel like it's not beneficial to him with who he's with. And I'm just realizing this like in the past couple weeks. So yeah. He won't be in her class next year, and I'm hoping for a better experience. So, so she will tell me, oh, it's bad. I need some strategies to help calm him down. And to me, it doesn't take me long to calm him down just by like talking to him, just saying, buddy, what's going on? Like, but I don't know I wish there was a camera so I could know what exactly was going on, because I feel like she's exaggerating from what I'm hearing from other parents. Like, she'll say words like explosive to me, which doesn't sound, to me, it sounds like he's like thrashing and throwing stuff. That's what explosive means to me, and that's not him. So I'm a little, I don't really know what that is. So
Thank you. We hear
yeah,
you.
yeah.
And then
Cooper, come put your mask back on. Come on.
he's drinking his water.
Oh, you stinker.
And then regarding his development, No, we were going over the chart and then at 2 months, or 4 months, or 6 months, we usually, that's different things that he's going on the right track. Many of them were completely normal.
Yeah.
What did you concern
Mommy.
I would say like 3 to 3.5 was when I'm like, man, he is like irritable with some things.
Okay.
It's when I kind of started to realize, and I thought maybe it was just, he's not used to being around other kids. The pandemic was happening, you know? So I don't know. Around that time, I'd say 3.5 was probably like the time I'm like, man, he's just irritable, or I don't know. He seems to have more like he screams and will be loud, but he's easy to calm back down. I don't know what that is. So
I think regression, or, those milestones that he achieved, walking and going faster, even toilet training, any regression of those.
no, I mean, we waited a while to toilet train him because we could tell he wasn't ready. Hey, Cooper, don't play with that, buddy. I don't know. Leave it on. So we waited a while. He was like between 3.5 and 4 is when we started, because when we tried, he was scared of the toilet. So I didn't want to traumatize him. But then once we did it, he got it in like a day. So I was glad we waited because I don't think he was ready. But other than that, he doesn't have any accidents or anything like that. No, I don't think he's had any.
And with regards to his speech, is he able to express himself, talking to you? Like sometimes kids are able to tell us the stories, meaningful things, not just like little kids.
Yeah.
Do you think that you can have a conversation with him about what he likes? Or?
Yeah, but he's not like advanced in speech. I feel like he's like average or maybe even a smidge. Like he's good with his language, but some days he's like not that good. I don't know how to explain that. Some days he will talk to me like, I'm upset because I have to go to school, and then other days he's like, oh no, like he's can't form sentences, or it's kind of jumbled. So yeah.
Okay. Does he ever be late on his speech?
No. No, he talked well early, and I think it's because my daughter didn't, and I was working really, really hard with her and being like more aware of my speech and making them talk, or making my daughter talk. I think so much of very young. So I feel like he started talking young and more clear, younger than I thought he would.
And then regarding, I'm seeing you telling him about directions, and he's listening.
Yeah.
He follows most of your directions when you tell him.
If he like knows what's expected, yes. Like I had to tell him like today, my daughter's like, can't go to the doctor, Cooper, and then he got like anxious about it. And I was like, it's not Dr. Weisenberger, his pediatrician. Like, it's a new doctor, we're just gonna talk and play, and so he's like, oh, okay, So he like gets a little anxious, and then he's like easily.
He's receptive to your
like
your voice and to the sentences.
Yes. I feel like pretty much anyone can talk to him, but if they act like elevated and angry, he does not respond well at all, which I think is what the issue at school is. Because he'll come home sometimes and say, Miss Amy's mad at me. And I'm like, you should never know a teacher's mad at him. You know what I mean? So I don't know if that's what her issue is, but so.
And then when he's talking, right now he's not talking to me, but when he came in, he was looking at the circles, making eye contact with Dr. Williams. And a little bit to me when he was drinking the water. When you talk to him, he has good eye contact.
Oh, yeah. Yeah.
With dad, with sister, Okay.
Yeah.
Great.
And I to anybody who start talking and be like, this cup is blue. Like, just random stuff, but he'll go up and talk to anybody and make eye contact. And pretty good. I'm not too concerned with this speech
Dog
impediment.
up there.
What do you want?
Dog up there.
Where's your mask?
There.
Yeah, can you put it on?
Oh.
What about getting along with other kids?
He is fine, but he always thinks like every kid's gonna take his toy and so he tends to, can you put your shirt down? Cooper, put your shirt down. He tends to play by himself in groups of kids. Like he'll run around with other kids, but if he, in our basement, we have like a room of toys, he'll tend to be kind of by himself. He doesn't like want to play with other kids as much, I feel like, as my daughter did. My daughter acts like she can't play by herself at all. And he loves to play by himself.
Do they get along?
Yeah,
Okay.
yeah, they get along really well.
Well, restrictive interest, like, is he maybe, like my daughter, like, you're just like, I'm anything specific that he does obsessed kind of with things?
Say it one more time.
Like obsessed with a type of toy or with an activity?
Oh,
or
yeah,
anything
he
like
gets
that?
upset, like right now, he's obsessed with, like, everything he brought today is like a form of a vehicle, and he'll be obsessed with that for like a week. Like he brought a sled, a Mario Kart, and a truck, and he gets like that, like everything he plays with is a vehicle, and then the next week, everything he plays with is an animal. And then the next, yeah, it varies. He doesn't stay like obsessed with one thing.
Okay.
But when he does, he's like focused on just cars and just animals. Like I don't know, he gets like that.
And in regards to his routines, if you, like, for example, you wake up, you go to school, then you pick him up, is there any changes on the routines or the plans during the day? Do you feel that he gets stressed about it or angry, or does he have those outbursts when you have changes in the routine?
Oh yeah, both of them do, and I think they feed off of each other, both of my kids. So Claire's very like she likes a visual schedule and likes to know everything. And if I make a wrong turn in the car and I haven't told them where we're going, she starts going and then he starts going. I don't know if they're feeding off of each other. He doesn't do that as much on his own, but I don't have them separate a lot. So sorry.
Oh, no, he's good.
Wow.
Jumping and
I
running
know.
and climbing and everything. He's able to draw his things.
No, he's not as interested. Like my daughter loved to write her name and practice and trace. He's not quite as into it as he just wants to like and be done. Like just a quick, like hard scribble and be done. Where my daughter wanted to like trace at this age, but he's not into it yet. He's more into
I'm just gonna ask about like routine behaviors. Are there any words or phrases that you think
no, not really.
Nothing like that?
No.
Any tricks?
Just started like this week. He started like when he was running, he like kind of does this a little bit. And I think he's just excited because it's always when he's running. I've never seen him do that until this week. I don't know if that's something new. I just thought I should mention it because I'm interested. And I think he's just like, it's when he's like really excited and he's like running and his arm, instead of just running like this or whatever, he started doing that. But and he picked his fingernails, his thumbnails. I don't know if that's a trick. I don't know what a
Is
trick
that
is, I
something
guess.
that he does it like? Speaking of start.
That just started about 6 months ago. But his thumbs are like, we're up right there. He just like sits there and I don't think he thinks about it. I think he just.
You know, if it happens in a specific.
So he easily gets like with his nail shape. I don't know. When I trim his nails, I think he like
Step
hits
on
at
the
the corner,
square.
and then once a little skin comes out, he can't stop, like,
He's not picking anywhere else in his body.
no,
No.
just literally right there.
Biting his nails.
Nope.
Any unusual reactions to sound in the past?
I mean, he'll cover his ears at really loud sounds, but I don't know. Nothing I've noticed to be like.
We're not all square.
I mean, we all do that.
Problems with textures or foods or?
Oh, he is very, very, very picky with food.
My
Like,
fingers are not
like,
square,
it's
but
He doesn't eat bread. He doesn't eat cheese. He doesn't like sauce. He doesn't like pasta. So he's got a very limited food.
ah,
So he eats fruit all day long. He loves fruit, pancakes, peanut butter and jelly, hot dogs, but and like
Is that
chicken.
Pokemon?
You can get him to eat like
That's the
chicken,
sled.
but he's very.
Is that Pokemon? That's
Like, the
Mario.
pediatrician's like, don't try just
That
eating something else.
Pokemon.
I've done that so.
That's cool.
He just doesn't like it. So I don't know what that is, but he's very, very picky. He won't eat pizza or grilled cheese or anything with cheese like that. He just won't like.
That Pokemon.
Cheeseburger, nothing.
That's Pickle.
I'm just gonna ask you a couple more questions regarding his behavior. And I want to let you mention a little bit of things.
That Pokemon.
Yeah.
That's the race. That's the turn.
That he is hyperactive, like compared to the other kids, he's more
That Pokemon.
active.
That's a giant cup.
So big. No, I don't think
such
he's
a nice
like, okay. Where I can tell he needs like an energy output, like to run around a little bit, but hey, get that off of there. She just said, don't do that. That's the typical 4-year-old, yeah, right?
That come on my own.
Oh, oh my gosh, what was I saying?
In regards to him being hyperactive.
Oh, hyper. No, I don't think so. I mean, he'll randomly get, he'll get a little antsy sometimes in his seat, like he doesn't want to sit still. Like when we were out there, she said, all right, stand on the scale and then stand on the dot to get measured. And then she's like, sit in the chair. And he sat for like 2 seconds and then he saw something in the room and he's like, I want to go and see what's in that room. And just was like, and I said, no, come back. And he was kind of like, just wanting to check it out. No, put that back, you stinker. But I don't think of that like completely abnormal, but you are a stinker. Put that back. You gotta see your mom. Come on, put it back. Yes, you do. Come on.
And then any problems with aggression ever having when you have these outbursts, of his behavior? Does he ever become aggressive?
His teacher said he's hit a few kids before, and I've never seen that. His sister teases him a lot. Like she'll take a toy and kind of like, dang, how kids do. And he'll go, "Arr!" Like he gets so mad. Like I can tell he wants to like, but he never does. He just like, grits his teeth and like gets mad at her. But no, he doesn't. I mean, that seems abnormal to me. That she said, like it always surprised me when she said that in the beginning of school. She hasn't really said that since, but no, I haven't really seen that. I mean, he gets angry when I mean, not that I think he should be angry, but I mean, his sister taking a toy and then dangling in his face. I mean, it's not nice. Oh, where did it go? It went all the way under, didn't it? Uh-oh. You're gonna have to climb up on the table and reach down and get it.
Any concerns that you have about his safety?
No, he's actually, I mean, I know he's like all over the place in here, but he's always been like a cautious kid. Like he'll watch people do things first. I used to say when he was a baby, like I didn't need baby gates because he didn't want to try. If I told him no, he just did it, and he wouldn't try to go down the steps. I don't know if that's important, but yeah. If he's done something before, he's a little more fearless, like jumping off the couch onto the ottoman or jumping off his bed. He does, but I'm not concerned. He is a little more cautious than other kids, I think, his age. He doesn't get hurt really easily, if that makes sense.
Can you have to describe him? Like, how does he look most of the time? Do you think he's a happy kid? Is sad? Is he worried? How would you say?
I would say he's mostly happy. This is pretty spot on of him all the time. Unless, of course, if a kid, does something to him. I mean, he's not perfect. I'm sure he takes things from other kids too, but I usually only hear him when someone else has done something to him, like with his like yelling about it. Don't touch the switch. Remember, switches aren't toys.
You gotta leave this one.
But he's mostly really happy and in a good mood. I mean, he'll get nervous. Like he got nervous at soccer the first time. We got there a little early since we watched the team before. He said he was nervous and nope, don't touch the door.
It seems like there has been a lot of new things for him over these past years.
Yeah, that he's never had to do. He's been with just us.
Faster!
Can you tell a little bit more about his sleeping? Is he a good sleeper? How would you say?
He's a great sleeper. He quit napping when he was like 18 months old though, which was very young. But that's how he got his flat head. He slept so good as a baby. Like I would say 6 weeks he was sleeping through the night and never looked back. He's a really, really good sleeper.
You're very lucky.
Yes, I know. I'm like, I can deal with no naps as long as you sleep at night.
And he's not waking up with night terrors. He's not calling in the middle of the night. He's not having nothing.
Yeah.
You talked about his diet being a little bit restricted. Well, not restricted, but he's a little picky.
Yes.
It's not really normal to see that. But he's eating mostly. It seems that a group of fruit.
Yeah. He won't eat vegetables. He will not touch them. We've been trying to do, when I used to take Claire, my daughter, when she was in like therapy, before she started school, she went through a picky stage. I mean, she's still picky, but not as picky as him. They told us like to have them smell it and kiss it and, touch it to your face. So we've been trying stuff like that and then just offering him every time. And sometimes he'll lick it, which is good, but he always hates it. Always. Even if it's like a roll, like a bread, he doesn't want it. He's very picky.
We already talked about the color. And then regarding his, we call them self-care skills, like he's able to dress himself.
Yeah. He has trouble with shirts, but he does good once we get started. One thing I want to mention, and I don't know if it's normal because he's my first boy, he touches his penis all the time. I don't know if it's like too much or if it's normal or what, but I feel like it's a lot. I don't know if that's something I should say.
Pretty common.
Yeah, okay, because I'm like, it is a lot. And like, sometimes he'll like, I don't know, put it on, like how he just had it on the bed. I'm like, what are you doing? So I don't know if that's normal. I don't see other kids doing it as much, but.
It's pretty normal.
Okay, well, just thought I should mention. But no, other than that, he goes to the potty himself. He even like wipes. He has trouble with socks, but I feel like that was kind of an issue for my daughter too. But with underwear, pants, and shirts, he does really well.
Okay. And the trouble is putting them on or?
With the socks?
Yeah.
Yeah, it's like the scrunching part to kind of get it going.
Okay.
But once he gets it going, he can pull it up over his heel. It's just that getting it on the toes part.
Did you take a shower?
Honestly, we haven't really ever tried to have him do it by himself yet. My daughter does
Gotcha.
now. I haven't tried.
Okay, and he's feeding himself too.
Oh, yeah, yeah.
Okay. Well, I think those are all the questions that I have, but I want to open, the conversation to you and tell us anything that you feel that is important for us to know that we might not have asked.
I think that was it. I think he said everything I wanted to say. Yeah, I think. Yeah, I think so.
Do you have more questions?
Okay.
If you remember anything, please let us know.
Okay.
Thank you so much for sharing with us.
Yeah, thank you.
Andre did a great job. I'm gonna ask just a few extra questions and then Amber's gonna ask some
Okay.
questions too. I'm just gonna ask you details here. With speech, do you feel like Cooper can have a back and forth conversation with you?
Yes.
Can it be about something you're interested in, or does he kind of redirect it to stuff he's interested in? Or do you-
I don't know. Never really. No, he'll go back and forth a little. I mean, it might end that way where he kind of goes back to something he wants to talk about. But no, he'll go back and forth about things I want to talk about.
Does his language ever sound like it's something that's like directly that someone else said, or directly from a TV show or program?
No,
Or, okay,
not like my daughter used to do that.
Yeah.
She used to live. Sorry, I don't have to say. Claire used to do that. She would repeat lines from movies. He doesn't do that.
okay.
I mean, every once in a while when he's playing with a certain toy, he'll say like a little bit of what they say, but not in normal conversation like she did.
And do you feel like he brings things to show you and to share with
Oh,
you?
yeah.
Okay.
Yeah.
Does he seek you guys out at home to interact with him and
Oh,
to
yeah.
play with him?
Yep. He loves to play games. I know you heard the word, didn't you?
Yeah, we are game.
What do you like? You got a new Mario game for Christmas, but you don't like to play yet. You just like to watch me play, right?
The favorite things are the toy vehicles I heard in the past, animals, Mario games. What else does he like to do?
He still likes to play with dinosaurs. That kind of comes and goes.
Okay.
He likes to play games on his iPad.
Uh-huh.
He does ABC Mouse on there. Don't shout. No, that's not a toy.
These kind of outbursts or meltdowns that he has, would you say it's every day that this occurs?
Yeah.
How many times a day roughly? You would say?
If it's a non-school day, it's different than a school day.
Okay.
School days, he wakes up, he asks if he has to go to school that day, because he's off one day a week on
Yeah.
Wednesdays.
Uh-huh.
So he's always trying to figure out that. I see you too. He's always trying to figure out if it's that day because he doesn't want to go.
Yeah.
So when I tell him it's a school day, we have, I don't want to go to school. I want to stay home with you. I want to play with my toys. But it's not as bad as it used to be. Like it's more him talking to me instead of screaming.
Okay.
So he'll go through why he doesn't want to and tell me his reasoning, which is great because it's so much better than his screaming. So then it's after school. Can I have candy when I get home? No. Why? We'll have a little bit of that. And then if anything changes, like sometimes they don't want to go to my mom's. I work at night, so I have to go to my mom's. I don't want to go to my mom's or I don't want to go to grandma's. I want to stay home. I want to play. But his outbursts at home have been completely different than what I'm hearing is happening at school. But again, I don't know what's really happening at school. I hate it.
Yeah.
I had such a good experience with Claire that I'm just,
Yeah, that's hard.
yeah.
So is there something you guys have to do to kind of calm him down, or do you kind of ignore him, or what? How do you handle an outburst?
Sometimes I know when it's like, first we need to it's because he's nervous about something or doesn't understand what's going to happen. Like I'll talk to him. Sometimes it's just him being a 4-year-old and being like bratty and not listening. And then it's like, you're going to timeout and we'll come back to you. You know what I mean?
So when you feel like you need to use discipline as timeout, typically what you do, or?
Yeah.
Mommy, it's you.
I see you too, but he hasn't been in timeout in a long time
Okay.
because he's been talking. Yes. But he's been talking through his tantrums with me. And so it's very easy to know exactly how he's feeling at home. So I guess the biggest concern is more his outburst at school.
Yeah, okay.
Again, I'm realizing now maybe it's more of a future issue. Because another, no, remember I just got my shot?
I come in bigger.
No, I'm talking. Hey, go get your mask.
I just saw what you were talking about. You know, you mentioned that a little bit. Do you ever notice any kind of body tensing like this or like this?
Only when he's mad at his sister. I've ever seen him just do this, like, and then he's done. Not really I've never seen him do it when he's not mad and looking like he wants to take his toy back and probably hit his sister, but he never does.
Do you ever notice him like looking at something really close, kind of studying something, inspecting it a little bit?
Yeah. I mean, never thought of it as anything different, but yeah, he'll look it over and go, Mom, look, it's got blue eyes, or this has green eye, or whatever.
Okay, it
Yeah.
doesn't seem different to you necessarily. Do you ever notice Cooper looking at things out of the corner of his eye or off at an angle?
No.
Does he like to spin or rock or like kind of jump more than you expect, like
No.
a repetitive way and all?
No.
Okay. Any lining things up or sorting or organizing things in a particular way?
No, like after Christmas when he got like some new things that were all in a group, he would, put them on the table. But I think that was just, it didn't seem abnormal.
Okay.
Like my daughter like categorizes things and, it's nothing like that. He's a little more messy with his play. He's not as, I say Claire OCD because, she's very particular and it's gotta be just right.
Can he ride a bike yet with training wheels?
Yes, it's not his favorite activity, but he does.
I'm climbing to the top.
Yeah.
I'm climbing up to the top.
I'm pretty tall.
Otherwise, no concerns with coordination really or anything like
I
that?
don't drive to the top. I don't drive
Any constipation?
bigger.
No.
I'm gonna drive smaller. I'm gonna drive.
Has he ever had any evaluation before this one for any, like any speech or any kind of help me grow? He never had any kind of evaluation?
No.
When I'm 20.
And any, looking at the medications in his chart here, is he on anything on a daily basis right now?
Yes,
Every
he's
single
on
day?
antibiotic right now. They did kind of a lower dose long term because we haven't been able to shake this last year.
Gotcha.
So I was at the doctor literally every other week for like 2.5 months before Christmas.
Oh, wow. And is the back room, is that what he's on?
I don't know what it is
Okay.
right now. He put him on one and made him sick, so I had to get a different one.
Gotcha,
So I don't know the name of it. I'm sorry.
Okay, no, that's okay. Okay.
The pink one made him not. I think that was Bactrim.
Okay. Wait a second.
Yeah, that was the bad one.
Okay. And what is the name of his school?
Dulles, John Foster Dulles.
So you go, 5 days a week?
Yes, 4 days.
4 days a week.
Half day.
Mornings.
Yes.
And how do you feel like he's doing with his pre-academic skills?
He's good.
He can identify all the letters?
All the letters, he can count pretty high. I don't know exactly how high he can count, but pretty high. And he's noticing words that he sees all the time. Like he can tell Claire's name and our last name, and he can spot his name. He's doing really good.
He counts at 20 or?
Oh, yeah,
Maybe more?
I think more.
He
Okay.
recognized 100.
Hey, Cooper, how high can you count? Cooper, can you count to 30? 1. Come on, can you do it?
But I want to count to 10, 20, 30.
Yeah, and he like will count to 100 by tens.
Okay.
Like he's good. Yeah.
50, 60, 70,
And I-
80, 90.
Yeah, you did a
Good
nice
job.
job. You sure can. I heard you say scribbling, but can you draw a circle?
Yeah.
Okay, how
I mean,
about,
it's not perfect, but yeah.
a cross or an X?
I don't think so.
Okay,
I don't think so yet.
okay.
But that's just, he's just really, really not interested in
And that, yeah.
writing it. Like he loves to learn it and know it
Yeah.
because he's really proud of it. He'll go, "Are you proud of me?" Oh, it's so cute. And I'm like, "Of course," but he's not interested in learning to write.
Okay.
So put- hey, I'm not gonna tell you again. Go put your mask on.
Any,
Yeah, big boy.
skin problems? He said?
Yes, he has eczema,
Eczema, okay.
and it gets really bad in the winter. So he has spots like around his waistband, on his legs, on his ankles.
Okay.
He doesn't really get them on his trunk. He used to, and on his head, he doesn't get those anymore. So it's mostly waist down. And I think it's more like, I use hypoallergenic, but I don't know if it is the laundry detergent or what, but yeah, he'll get big patches that are itchy.
Any concerns with his vision?
No,
And I know he said that, has he had his hearing checked
I think
with all the, in the past? Did he have it checked? Just at the pediatrician?
probably just, yeah, no more than the
Okay,
pediatrician.
okay. Do you have concerns with his hearing?
I've always wondered just because he seems to talk at a loud volume and like.
I'm assuming they checked it when they got the tube, when they.
Oh, yeah, I'm
Yeah,
sure. Sorry, I didn't think about that. Yeah, probably. It was so long ago.
Yeah,
I
but I
can't
can see
remember.
what you mean, like with him speaking loud, that you might have those concerns.
Yeah, my daughter, Claire, she talks really loud too, so I don't know if he just thinks that's normal
Right.
or what.
Any, problems with heart or lungs that you know of?
No,
Okay. Kidney or bladder problems that he said?
no,
Has he ever had anything that looked like a seizure to you, or like a steering spell, like steering off, anything like that?
nope.
And then, obviously, Claire with a history of autism. Anybody else in the family with a history of developmental issues?
I was diagnosed with ADD in grade school.
Okay,
I was probably in 5th or 6th.
okay,
I think it was 6th grade. Yeah, and I got on Adderall and it made me, like, it made me crazy.
Okay.
So I never have done anything
Yeah.
since,
okay.
but
Anybody else in the family with anything along those lines? ADHD, anxiety?
so I'm adopted. So
Okay.
I don't know my medical
Right.
history.
Wow.
Don't do that, please. Don't do that.
How about dad or dad?
He thinks he's never been diagnosed, but he sometimes thinks, I think I might have ADHD.
Yeah,
But he has never been diagnosed. No one in his family has either, so
Okay.
I don't think so, you know.
Amber's gonna take more detail on that.
Yeah.
But, and then, was he, did I hear you say 37 weeks? He was he born 3 weeks?
It was 36 and a half.
36 and a half, okay.
Yeah.
And I probably wasn't typing fast enough, you probably already said it, but was he born by, vaginal or C-section?
C-section. And I had a C-section with Claire, so they just scheduled me for that.
Okay.
I didn't try, yeah.
And they decided to do it because of the,
Low fluid levels.
Okay.
I was on bed rest for 2 weeks and it was getting better, so they
Yeah.
were like, "We're doing great." And then I was going in 2 or 3 times a week,
Okay.
and then at the last one, they're like, "Oh, it's slower than when we told you to go on bed rest, so
Okay.
it's time." So,
any problems at the delivery?
No.
Did he have to stay any longer than you stayed in the hospital?
no.
Oh, you ready?
Thank
Pick up.
you, thank you for,
No, you're all right.
I'm trying to keep up.
No, you're fine. He was over 6 pounds too, being that early. I thought that was.
Amber's gonna take a much better.
Yeah, so I'm a genetic counselor. One of the things we do is use family history to kind of help identify risks for kiddos. So I'm just gonna ask a bunch of questions about family history. Do Cooper and Claire have the same dad?
Yes.
You said you're adopted.
Yes.
Have you heard anything about any of your biological family?
It was a
members?
closed adoption. They did just do, and I got an ancestry DNA kit for Christmas,
Mhm.
just so I could maybe get
Yeah.
some medical history. 'Cause, you know, my cousins get like breast screenings early. It's stuff like that I want to know. But no, I haven't.
Nothing.
No.
Okay, what ethnic backgrounds are you? Did you
Just
find out what
white.
your kind of?
Yeah. I got like a paper. My mom got a paper when I was born.
Uh-huh.
Yeah.
And then Cooper's dad, does he have any brothers or sisters?
Yes, he has a brother and a sister and a half brother.
So two full siblings, and then the half brother, is that through his mom or his dad?
Mom.
Empty.
She is empty. What's out? Remember?
And are his parents still living?
Yes.
And on his side of the family, I don't know how familiar you are with them and
Yeah, you're
their
good,
health, but anybody with intellectual disability or a diagnosed genetic condition?
So let's see. How is this a relation?
Mommy, is it time to go home now?
No, not yet. I'm sorry. Is okay. So my husband's great uncle was, I don't know if he had cerebral palsy. I'd have to ask him that would be his great uncle.
Okay.
I don't know what-
Some history of that.
Yes,
Yeah.
yes, but other than that, no.
And then all, your husband's brothers and sister, do they have kids?
His sister has 2 children.
Okay. And are they healthy, meeting milestones?
Yes.
Are they doing any like special education, have IEPs, anything like that?
Nope.
Nope, okay. Good to hear. And then the 2 brothers, no children for them?
No children.
All right. Any history, on that side of the family of children being born deaf or blind that you can think of?
No.
All his siblings are doing well health-wise?
Yeah.
Okay, and his parents, how about them? Are they doing well? Any history of like,
Who did you
conditions
ask?
they've
I'm
had?
sorry.
Sorry, your husband's parents.
Okay, so his dad is not in the picture. He lives in Florida. I saw him a couple years ago at a funeral. That was the first time I met him. He's fine and healthy as far as I know. But we don't have a relationship. So, but his mom is good. Yeah.
Okay, that's good to hear. Is there any history of like psychiatric conditions like bipolar disease or anxiety, things like that in the people we've talked about?
Yes, so, my husband's brother, both of his brothers had a history of depression.
Okay.
Both of them are gay,
Okay.
and the one is very not happy about that. So he's like had a suicide attempt, and I don't know if it's bipolar or just depression, but he has some major mental health issues.
Is that the half brother? Or
That is Chris's full brother. Yeah.
I'm sorry to hear that.
Yeah. He's getting better. He's in therapy, but
That's good. I'm glad he's got some support. Sounds really
So
hard. Anybody who had
don't ever ask that. I love you always.
anybody with seizures?
Chris's cousin has a seizure disorder.
Mommy,
And then Claire, she had an episode, we had to get an EEG for her, right before Christmas. She fell on her butt and then had what looked like a seizure. Like Chris went in, my husband's a nurse, so he was like checking vitals, and she lost bladder control and her eyes deviated. But we went through everything and they think she just passed out. So we don't know. We're watching that
Okay.
closely.
Yeah. Anybody with cancer diagnosed under the age of 50? I know that's a really broad question.
No, I'm just trying to think. No one in Chris's family.
Okay.
Yeah, no.
Okay. And
Oh, Cooper, no.
oh.
Cooper, those are not toys. Thank you. I'm gonna play the Olaf game on my phone.
Yes.
Okay. Is that okay? While I talk to you guys? Okay, go sit down.
And any other history of, anything I didn't ask about that you can think of in the family? Sounds like things are pretty stable and, nothing major that seems to be tracking through the
Yeah.
family as far as I
No.
Yeah, that's awesome. Good to hear.
I have one last question before we examine him. So we definitely heard like what your biggest concerns were around the behavior for this visit today. Do you have particular concerns about autism or any other particular diagnosis that you've been worried about?
No, I don't know. I'm unsure if there's a real issue or if it's just, the factors of pandemic and being home with me and not around other kids. I don't know.
Right.
I've never thought, the only thing is sometimes, I don't know, is that normal? Or is it just,
Yeah.
is it something more? I don't know. I don't know.
Right. Well, you're in the right place.
Yeah.
That's gonna be our job to help with that. These evaluations.
And we know, hereditary, we already have a kid with autism. It's,
Thanks for your patience with all of these. Now we'll examine. Excited.
I know, sorry. Hey, Cooper, can I have my phone, please?
What?
Can I have my phone, please? I gotta check on grandma. Okay, why don't you sit on the table? I know, but in a little bit, I'll give it back, okay? Come here. Cooper, can I listen to you?
Yes.
Yes. Do you know where your heart is? I would say maybe
Is it here?
Yes.
6 months ago, that would have been a bigger,
There.
Where does this go?
like he just said, like, I want to play that for a little
Yeah.
bit more.
Not there.
That would have been a just straight screen at me.
Well, that's good.
Yeah, so I feel like he's, we always say, like, we have future words, we need to talk it through and we need to know what you're, so I,
Right. Good.
I.
With that?
Yes.
All right.
Sounds like it.
Can you breathe with your mouth open like? Take a deep breath. Look. Yeah, let me go around your shirt. All right, girl, listen. Take a look. Thank you.
What's your name?
My name?
Yes.
do a deep breath.
Cute. He's doing great. Is he always good with the pediatrician?
Oh my gosh, yeah. The pediatrician is like the warmest, nicest man.
Yeah.
He's retiring in June. I'm like, oh.
Have you found everyone?
No, not yet. I've seen a few in the group, but they're not as warm and fuzzy. I need a warm and fuzzy. 'Cause
Yeah.
They don't love to go.
Yeah.
Bella's making sounds.
I didn't realize he was retiring.
Yes.
I would definitely
They
recommend.
have not made an announcement, but my mom works for health associates and she told me. It's June or July, I can't remember, but
Okay.
either way, it's too soon. Not happy about it. But
Yeah.
it's good for him.
Yeah.
One of the other doctors passed away.
Oh my God.
Dr. Maloney.
When he was swimming or something?
Swimming, yeah.
I
He
heard that,
he
yeah.
did like a swimming competition or something. Oh, come back over there. You gotta do your work first, okay?
Wanna help me? Hey, thank you so much.
Kind of had a list, like a small little
Yeah.
list we've been working on, so he's been trying really hard to say yes
Mhm.
with his teeth, and so if you hear it sounding a little weird, that
Mhm.
I forgot to mention that, but he's aware of it and tries to do better.
Can you remind me what kind of work you do?
I'm a hairstylist.
Oh, and you work at night?
Yeah.
What?
Work in the
In the
evenings.
evening? People probably love that.
Well, all my clients work, so I'm like, I kind of have to.
Yeah,
There would maybe be like a handful that would come during the day. But
yeah,
it's nice, we get to, Chris and I just switch
yeah, that's great.
roles.
Yeah, that works out well.
Yeah.
You work at a salon or?
Yeah.
Which one?
Revive Salon on Harrison
On
Avenue.
Harrison Avenue? Is that a big one or?
No, it's pretty small. I mean, there's only 7 stations.
Uh-huh.
We're doubled up, but
Yeah, that's great. You got the light.
oh my God, wow. Gotta look in your ears, just real careful. It's okay. Wow. Where your other ear?
You think the daily antibiotics helping? Has he been without an ear infection for a while?
This, we don't know if he still has one.
Yeah.
I need to schedule an appointment.
With
He
Angie?
still has another week of doing a week and a half of the once a day.
Uh-huh.
So I just need to see if he gets over it.
Yeah.
Because sit down. Not right now. Yeah, that is like brand new.
Okay.
I don't know what that is.
Yeah.
I think really, can I check the other armpit?
Let her check your armpit.
Now you wanna be goofy with me? I'm gonna do a couple things. You know how the dogs walk like this?
Oh, can you walk like a duck?
No. Yes, you can.
No, we're gonna be a duck first.
You jump. You jump. So good. Can you jump in my foot?
Are you a penguin?
Yeah, there you go. I love the penguins.
See if he walk up on his tiptoes and he toe walk?
No.
Cooper,
Hey,
you do one
Cooper.
more thing for me? Do this. Hold on, one thing. You do that? Two. One and two. You know how to count.
He's inventing any. Can
Can you show me how, can you show me how strong you are? I want to do something. Put your arms like this.
Oh, come
Put
on.
them like this. Keep them like that.
Yeah, keep them like this. Look, Cooper, look at me.
Yeah, keep them up. I'm gonna put them down. You keep them up.
Thinks everyone's gonna take them.
You have to laugh.
Come here. Do this.
Are you hiding behind me? Where did he go? Where did he go? What happened? We lost him. What did he do?
Cooper, come on back.
We're almost done, buddy.
Come on, do this. No, come on. 1, 2. Cooper, you're gonna get in trouble.
Almost done.
Oh, you want a sticker? See the stickers. Yeah, I know. I can give you another one. I think you don't have Spider-Man there. I can find stickers if you like them. Can you keep your arms up? Keep them up. them up. Oh, let me put them down. Be strong. Keep them up.
You're really strong.
Very strong. Good job. Like that. Keep them up. You're stronger than me. Oh my goodness. I'm so old. You're so good.
Ta-da, I got a sticker.
Yeah, I'm gonna get you when we're done. Can you kick that up? Good job. Kick it hard. Like a soccer ball. Kick it. Ah, good job. Like a soccer ball. Again. What about this one?
Can you kick it?
You're so
Whoa.
strong. You go like this. Show your shoulders. Keep them up.
Go like this.
No. You're so strong. Let's see your legs can jump.
I'm brave. Now we got both stickers.
Both stickers.
Oh, I got one.
Oh, cover your mouth, please.
Oh, thank you.
See, this
Have
is
you
why.
done this thing before?
Wait,
I show you.
that's a triangle.
That is a triangle. What color is that?
What color is it, Cooper?
Triangle.
No, that's what shape it is. What color is it?
Turquoise.
Yeah, it is turquoise. Wow, that's very specific.
Turquoise.
Dark turquoise.
See any movements? I'm going to see.
And Lisa.
You know what? I'm
Nope,
gonna
you gotta
double check a
finish
couple
your
more things.
work.
I'm just gonna double check a couple more things. You're almost done.
Hold still.
Luckily, you're a very good patient.
Wow.
Like that hammer, huh? It's a good one. Can I see it? Take a look. You like that?
Hey, can I check on you?
Sure. Don't hit too hard.
Gently, yeah. Let me check you.
It's right here.
There we go.
How to do it?
You want to do it? Here, you can help me. Ready?
Have to ink. I do it.
Go gentle.
Muscles, see how strong you are.
Job.
Cooper, are there any pets at your house?
No.
No?
No.
Come here for just a second.
That one keeps going on and on.
There we go. Do it again. You did great.
Nice job.
You brush your own teeth?
Do you?
He would just brush the front four if I didn't help.
Yeah.
I don't have dinosaurs in there.
Dinosaurs now.
It's really good. What's that? Big salmon.
Yeah.
Yeah, he's very good.
Really good.
What is next? Next appointment is with biology
Okay.
at 10. So he
Okay.
has a few minutes. I don't know if he needs to run to the bathroom.
You need to go potty again?
So strong.
Put that down. That's not a toy.
Do you have any questions right now? I mean, we're gonna be just, going through all these different
Don't forget
evaluations.
these.
And at the end, we'll be able to sit down, go over all the results together, which is really helpful.
Yeah. Okay, put that back where you found it.
Oh,
on the
no,
desk.
no, no.
Now we gotta go to one more doctor and then we can go.
If you wanna hang.
Now, the worst
Yeah.
part is, Sam, if I am, what we may do, is talking to Shannon,
Ah,
I'll make every effort not to.
Thank you. Not that they won't benefit from hearing and all, but this is the only way I think it'll work. And if we can leave the door open, that would be ideal, or at least cracked. Then we can still keep. I tested it earlier on my laptop, and I kept Wi-Fi as long as it was at least cracked.
You. I try to say something like it's like entering
Yeah.
like Wi-Fi gun. You entered the black hole of the Wi-Fi universe once you hit the close. No. No, I don't know that. You might get something. My guess is you have something from 3 to 5, it's just not.
I think you're still in pre-charting, Sam. You're still in pre-charting in Epic. Do you want to put it in so I can record at least numbers for you, or you want to do it all?
I'm not out of the booth. I can't do it all, but yeah, you can record numbers. You can record numbers.
Bouty. That I would have never gone there.
Some system work. As so long as that system just go.
Come up.
Yeah. And then
Good. You rock, darling.
Oh, I love it.
Okay. So if you hear me, you have to keep the mic speaker or the monitor speaker on the audiometer.
Where it is, correct? You want it on the audiometer? Where do you
So
want it?
the talk back has to be through the audiometer, not through the headphone. I don't know.
Sure. Yeah, yeah. We'll make that every effort so that Shannon can hear as well. Yeah, but you gotta get a signature, so.
Oh, okay.
Mr. Cooper, Bouty. So typically, anybody 6 and over, we could probably test independently.
Okay.
You would need another physical person to run equipment because quite honestly, equipment here, patients over there, that's a real hardship.
Okay.
So.
Hello.
Hi, Cooper.
Hey, hi. My name is Sam. I'm with Dr. Charles. I'm working with you guys today. That's Dr. Eichert.
So nice to meet
And then
you.
Shannon's here as well.
Hi,
I'm
I'm
a social worker.
Oh, okay.
Mom, we have
all of the
500 coat hooks. You are welcome to hang things up.
And then I'll be your lead.
Okay.
So I'll just like call or email and stuff.
Okay.
Like if there's anything that comes up or if you have any questions, I can send you.
Okay.
my email.
Perfect. That'd be great. Thank you.
Awesome.
Mom, we do. We have 500 coat hooks. This is a
Oh.
lock suite. Yeah. You don't have to be the pack mule all day long, right?
Just most.
Just most of the day. I know, absolutely. Well, I'm gonna let Sam ask you guys some questions while we do this.
All right, we're gonna head right in here, actually, so you got the right idea. All right, Mr. Cooper.
Should I shut the door?
If you want to keep it shut, that's A-okay. We can leave it open for as long as we want right now.
Oh, okay.
We'll
leave it open, buddy. Hey, I think you're gonna sit
Yeah,
here.
you're gonna sit way up front with me.
Younger kids, we would definitely.
Nice
encourage
work.
them to go to
What did you bring in your backpack? What did you bring in there?
My cat.
Not,
He's a little upset. I think he left his Mario Kart out
Oh,
at the last thing, so.
Ah, okay, we can try to get that back.
Yeah, I had her call.
Yeah.
I don't know.
yeah, and
so-
history of middle ear disease.
Never mind.
and
So,
that's just
this
the
is the audiology
same
booth.
thing from her side, and it
I
was
did see
anything
this person
like
Yeah,
that.
actually had a ear infection, is that true?
Yes, maybe
Okay.
potentially still does. I don't
Okay.
know for sure.
I know it's been- it's been all-
Yeah, he's had a lot of ear infections in the
Okay.
past couple months. So we've been at the doctor, and I don't know, for between him and my daughter, like every 2 weeks for the past 2.5 months or so.
Okay.
So the pediatrician wasn't sure if he was completely healing from the ear infection. So
Okay.
this was a 2 times a day for a week, and then once a day for like 2 to 3 weeks, he said. So we're on
Wow.
the second week.
That's like a
Okay.
prophylactic because, so typically you'll be on an antibiotic
Okay,
for
another
10 days,
week. Yeah.
2 times a day,
Um,
maybe 3 times a day, depending on the antibiotic.
And
But once you're finished with
so I saw that he has
that,
had chronic
if you're
ear
not
infection.
really healed, they
And
might
I
put
thought,
you on
did he
antibiotics
set
for
up
a month.
well?
Yeah.
because
Are they one away
that
from
is
getting
not a good
another,
plan.
one ear infection away? from getting
400.
another. Don't touch that.
One ear infection away from
That's
PE tubes.
Super.
I'm telling you, he's gonna
400.
get PE tubes. And we're gonna help him make that
and-
decision
Yeah.
today.
Mr. Cooper, can I give you some toys to play with? What do you think? Let's see. I've got some rings and I've also got some spiders. Do you want to see my spiders?
Wow.
Can you see my spiders for me?
Go with
What is
low
it,
interest
Professor?
rates so that she is actually
We'll give out some more toys later. Let's play with these ones.
Take these toys
Oh,
away
and there's a
and
boat in there? How did the boat get in with the spider?
with-
There's a camera there.
There
with all
sure
the things
is.
that
Oh, so he had just.
There's a dragonfly.
Very
you
good.
want in his
And when
There's
was
a more toys in there.
your case history.
He was
Hey,
only
there's a
4
more
months
toys
old
in
or
there.
5
There are, we're gonna get some more later. I gotta talk to mommy first, okay?
Actually, it was 3 years ago yesterday.
Okay.
Because
Spider.
we came up on Time Hop with him in this little gown. And it was just yesterday, so 3 years ago.
How convenient
Yesterday.
that we got our social media. No.
I can't keep up with dates anyway.
Of course. And has he had his hearing tested previously?
I don't think any more than like with that, like with the ENT
Yep.
appointments with that. I don't
Okay.
think so.
And do you have any concerns?
Not the colors.
No, I mean, I don't really know. Sometimes he talks really loud, so I kind of don't know if it's the hearing thing or if it's just his sister talks really loud too. So I don't know.
Okay, fair enough. Fair enough. And how is his speech and language development?
Good. I don't have
That
any
one's really
concerns.
big. No concerns with
Louder
speech.
so everybody else
He
can
He has
hear
a
it
little
more.
bit of a lisp with some
That was
words, but it's
stupid.
not that he doesn't know
What's
how. It's just with
that?
emphasis on the end of words,
Okay,
but he,
very good. And birth and pregnancy, were there any complications?
I had him at 36.5 weeks.
Good feedback.
Because I had low fluid. I was on bed rest a few weeks before that.
Okay.
Can we play?
I gotta get more toys out after, but first I want you to see, can you give me all the purple ones? Where are all the purple ones?
They're here.
3 and 4. Did he have any?
5.
Very good.
He was.
I got 5 purple ones. How what turn you going to get?
And we might just kind of skip over some of these questions to get the evaluation going earlier so we can hold his attention.
3.
That is
He got bored
okay.
at the end of the appointment of the last one, so
You
he
gave
was
me a little
like,
update this morning already.
5.
That was no overt
You
concern
got
for
some
her.
red.
We were gonna go play a couple of games. All of the reds. You're doing such a good job sorting these. We have 1, 2, 3, 4, 5 reds so far.
And I've got some greens. 1, 2,
Great.
3.
So a couple of measures on the ear. How did you do with having your teeth looked at the doctor's office? That stressful one or pretty okay?
I got 3.
it's stressful, but like,
I'll
he
get
did
some
good.
oranges.
Awesome.
Yeah,
1,
I just looked at him twice down there.
I got orange.
No worries.
All right, so I might skip over the peek in the ears. We've got objective tests that we'll do first, and I'll kind of show them how everything goes. Mr. Cooper, can you have a seat on your chair for me? Oh, good job. We got to put them away first. You're right.
And then we can play the.
And then we can sit in the chair and do your work.
Yes, now we got to do some work, and we'll play some more games, okay? So we're going to move your backpack right over here. You have a seat. Good job. All right. I'm going to go right over here and I'm going to get one of these little tips. Let's see. And can you hold it for me? It's kind of squishy.
Wow, it is squishy.
It is squishy. And check it out. I've got an ear camera. Can you put that on the top of my ear camera? Let's see. Push, push, push. Oh, good work. I love the way you helped me. All right. So what this does is it takes a picture of your ear and it shows up right there on my computer. How cool is that? Did you know that your ears can draw pictures?
Yeah.
Yeah. All right. So we got to listen. This goes up on our ears and it goes hum and it draws a picture. Are you ready? Can we see? Let's see. Want to help me? Ready? Up by your ears.
We try again. And we might need a bigger one. Yeah, let's go bigger. We'll get a blue one. Here. No more red. Should we get a blue one? This one right here. All right, Mr. Cooper, you've got to help me again.
Oh, sit
Oh,
down. Nope,
Yep,
nope.
it's in the garbage now. Can you help me with the blue? Let's see. All the way on, just like that. Oh, good work. You're so strong. All right. Ready to help with this one again? Let's see.
Hi,
Dad. Hi, that's Dr. Eicher. That's Miss Susan over there. All right, we'll try this one over here. We try this here. Yeah, ready? I'll count. 1, 2, 3. Good job. 1, 2, 3. Same picture. Very good. You did it. See those pictures you drew? Good work.
Good job. Hey,
What's
can
that?
I play one more game now?
We're going to play one more game in just a second. Can we try this here one more time? Now I've got really cold hands. I'm so sorry.
1, 2, 3.
See, let's try again.
Hold still.
1, 2, 3.
There we go. All right.
Let's play one more game now.
We've got some negative pressure on both sides. We're going to play some games in just a second, but we've got to wear some headphones first. Oh my goodness.
My headphone doesn't want headphones.
Can I show you my headphones? Let's see. I've got these ones. And gotta listen because Miss Susan's gonna say a whole bunch of words. Are you ready? Can you say all the words that she says? What do you think? Can you say hot dog?
Hot dog.
Say airplane.
Airplane.
Say toothbrush.
Airplane.
Oh my gosh, you're gonna be so good at this. Ready? Let's listen. I think she's gonna come from one of the speakers. Ready?
We're gonna do speakers. I want to see if you can wear the headphones, Cooper. Are you gonna wear the headphones for me? Let's put the headphones on so you can talk through the headphones. Are you ready? Listen to me. I'll be on the headphones. Are you ready? Okay, put them on. Now Cooper gets to hear me. Hooray. Cooper, I want you to say cupcake. Good talking. Cooper, I want you to say ice cream. Cooper, I'm going to whisper. Are you ready? Cooper, say toothbrush. Say toothbrush. Oh, Cooper, now you get to hear me with the earphones on. Let's say those words. Are you ready? Talk to me. I want you to say baseball. Good talking. Listen. Say cupcake. Oh, Cooper, I'm so glad you get to talk to me. Are you ready? Say cupcake. Say hot dog. Say airplane. Good boy at 10. Hey, Cooper, I want you to say ice cream. Yes, say popcorn. Say hot dog. Nope. Say birthday. Cooper, say hot dog. Say airplane. Say baseball. 15 and 10. Hooray, Cooper, take a break. Let's take a break.
You play with my piggy bank?
Yeah.
Or should we play with my bouncy balls? Which one? Piggy bank? Good choice.
Look at all those coins.
All right. Yeah, we've got all the coins. All right. We have to wear headphones when we play our game. Which headphones do you want to wear for our game? These ones again? Yeah, good choice. All right. Sit down and I'll put your headphones on and then I'll give you the pig, okay?
Okay, we're going to condition at a 40.
Very good.
Out of
Ready?
1,000.
Those coins.
And all of those coins. All right. Oh my
Condition at
goodness.
40.
They are so big. All right. Every time we hear our sound, we get to put the coin in. All right. Let's listen. I'll listen with you all the way up by your ears.
Great big left ear, 40.
There's our sound.
I'm going to make it louder.
I'm going to scoot
and
you in.
everybody
Ready?
else.
Good.
40.
All right. Here's another one. Listen really close. All the way up by your ears. There's our sound. Good job, Cooper. Ready? All the way up. Listen.
40.
Nice work. That's
Good.
it.
I'm going to try a 25, Sam.
Ready? Wow. You got good.
All right, I'm going to make him wait for the 10.
Ready?
Make
Listen.
sure
Up,
he's not
up
just
to your
going.
ears. Oh, what do we do first? We got to listen. Good.
10. 15 is where I expect it. Yeah, right there.
Yeah, good
boy.
job.
We're going to go to his right side bigger.
Which one? That one.
35.
It's
Yeah,
my sound.
Pretty.
There's your sound. You're right. Do you want a green
All right,
one? Or
I'm moving all the way to a
all
10.
right, listen close.
He's
All
going
the
to
way
be
up.
close to the 10. Nice.
Good work.
I'm going to see if I can't get him a little lower
Try
there.
a little one. All right, listen with both.
At a 5. Nope.
Oh, we got to listen
Yeah.
first.
He's a big false positive. Here's the 5. Here's the 10. Good.
Yeah, good work.
500 is coming in quick because that's where we're going to see it.
All right, which one? All the way. All right, all
Big
the way
at
up.
30.
Where's my
Yeah,
sound?
nice.
Yeah,
You got
that
it
was
all
a
by
good one. He tried to trick you.
All right, we're going to go to a 10. I don't expect it. How much negative pressure, Sam?
Negative 287 on the right.
I don't know. Is his left ear negative or flat?
Left ear is negative, but like 150 negative.
Okay. Here? No, no, he's a fast one. Yeah.
There we go. 2 again. All the way up.
No sound. I was cheating. Oh, I didn't do any sounds. Are you ready? I think you'll hear this one, Cooper. Wait for the sound. Are you ready? Big. Yeah. So
Good,
smart.
good work.
Cooper, I'm going to make you wait. Are you ready? Don't let me trick you. Wait and wait. Here's the 15. Nice job.
Nice work.
Left side is at a 30.
2 again.
No
Nope,
sound.
nope,
I was making you
no,
wait.
no,
I was cheating. Are you ready?
We gotta get our yellow one back
You
out.
can
Ready?
do it,
Listen
Cooper.
close.
You can do it. Oh,
I
good
dropped
wait.
it. Here's a new one.
You can
Here's
get
a
him
new
in.
yellow one.
Okay, this one's going to be easy squeezy for Cooper. Are you ready? Nice job, big boy. Okay, now Cooper, don't
Should
let
we
me
do
trick
little
you.
one?
We have to wait. It's the hardest part is waiting. Here's the 10. Maybe.
Good job. We'll try that again. Just gotta make sure.
10. Oh, that's way too fast.
Yeah, too fast.
It's all right. We'll let that ride.
How
I'm going to
about
try and go
green
fast
and
to see if
red?
I can see his difference. Oh. No sound.
Nope.
No sound.
No sound.
I'm tricking you. I'm so tricky. Are you ready? Nope. Hold it up. Listen for it. You can hear it. You have Superman ears. Are you ready? Here they come, Superman. Wait. It's not at the 10. Here's the 15. Here's the 15 again, because I expect it. Here's the 20. Come on, pal.
No.
Yes, that was the sound.
Good job.
So his left ear had less negative pressure because his left ear is coming up with it more of a lot.
No, there's no sound yet. Should we get a different game?
We have an easier sound. Are you ready for an easier sound? This one is so easy squeezy.
Ready? Oh,
Hold
we
it up
gotta
to
hold
your
it.
ear. Did you hear that sound, Cooper Cooper? Here it comes.
Should we get a new game?
Yeah, maybe.
All right, Cooper, let's take a break. Are you ready? Ooh, big break. Oh, stretch out your ears. All right. Should we get a different one?
Yes.
Okay. Do we want to play with the bouncy balls or the ice cream cones?
I want to play with that elephant.
There's no elephant down there. The bubble maker.
Yeah.
Bubble maker, bubble maker.
We'll do the bubbles in just a little bit. We have to play our game first. Do you want to do ice creams or do you want to do bouncy balls? Bouncy balls. Good choice.
I'm actually going to get his 4K next because I want it more.
All right, check it out. They're so bouncy, but first we have to wear our headphones. Are you ready? Okay. 1 ear and 2 ears.
All right.
Here's your green one. Ready?
Cody in
We
his
gotta
left
listen
ear.
first, and then we can put it in the bucket.
Yes, good job, Cooper. Okay, little bitty sound. Are you ready?
I read one.
Gonna hit him at a 10. Yes, Cooper, hooray! All right, let's see.
How
if we
about a
can
green one?
threshold that. I'm gonna keep that and move to the right side. Here's big. Nice job. Yeah.
Good work. All right. Blue?
I expect him to hear the 10. No.
No
Down,
sound.
big
No sound.
cheater.
He's
Oh, I was cheating again. I'm so tricky. Are you ready, Cooper? This one is a baby sound. Beep, beep, beep. Are you ready?
No sound.
Yeah. Well, let's do the big sound. Wait for the sound.
Listen.
Ready? Yes, big boy. That is
Good
right.
job.
Such a nice overt action. Here's another big one.
Red one?
Sound.
There's
No.
the boy. You heard it.
And a
Cooper,
blue one?
Cooper. We have to listen for the whisper. It's so quiet. Wait and wait. It's hard to wait. Shh. Yeah, I think you
I
did.
believe that. Yeah. Good work.
Hit the 0. Here's the 5 where he got it pretty easy. Yeah.
Nice.
Left ear, I'm going to stay little at a 5. 10. Oh, nice. I think the 5.
think
Let's
the
go
5.
for the 0.
No.
No. Gotta wait and listen.
0. 5.
Sound.
Yeah,
No.
5 for real. Yeah.
Mm-hmm.
Let's get 250
All
out
right.
of this.
Which one?
Huge.
Go for
40.
Both of them.
This one is grumpy. Are you ready for grumpy? Beep, beep, beep. Ready?
Ready. It's a sound.
There's the sound again. Yeah. Hey, Cooper.
Both
This
of them?
one is tricky. Can you do the tricky one? It's so little. 15, I don't expect.
No.
15 again.
You put them in there.
We
Wait
gotta
for the
listen,
sound.
buddy.
It's the hardest part. I'm being tricky. 15,
No.
25.
Sound.
There's the sound. That's right. We're going to see if that's a 20 or
Now we're
25.
done.
Not yet.
We've got 6 more. Let's count them out. Are you ready? Listen. Are you ready?
Ready.
20, 25.
Now.
It feels funny, doesn't it, Cooper? I like how you're putting that in. Good boy. Other ear. We've got 5 more, Cooper. 5 more. Big. Oh, just down.
Oh my goodness.
Cooper, this one is so little. Are you ready? This one is hard to hear. Here it comes, Cooper. So little. 15 probably. No way. There's no way.
Now you didn't hear those
That was
lines. There
sneaky.
was no sound.
Let's do it again. Oh, that's you. Wait. 15, 20. I expect the 20. Yes, big boy.
Good
Good
job.
job. 8K coming in.
We gotta listen for our really squeaky
Cooper,
ones.
here comes the squeaky. Are you ready? Cheep, cheep, cheep. We
Are
have
you ready for
four more sounds. 4 more sounds. Here they come. Easy. Yes.
Okay. These ones.
This one's little. No cheating. We have to wait. Wait and wait. Not at the 5. Maybe at the 10. Here's the 15.
What's it sound like?
Here's the 20.
Are you mommy?
Mommy's watching you
Ready?
work. She's so happy. Me too. Are you ready, Cooper?
Ready.
15. 20 it is. Yeah, we got it.
Is it almost full?
Oh, we have 2 more sounds, and we are going to get bone. Oh my goodness. 10, 15. Do it.
Yeah.
Let's get bone. I would like left ear first, oddly enough. Yeah. Change your game.
Right. Can you get all the rest of my balls in there? There we go. Take an ear break.
Yeah. I want to see how you're going to get masking on this one.
You know, have the earpiece in so I can hear Dr. Eichert, and I can hear the sound so I know when it's right.
I'm like, okay, I don't hear anything. I think I need the hearing test today.
I do usually start out my evaluations letting the parents know that. And I did it today.
I was just like, wow, I really.
Oh my gosh, look how many balls are in there.
Can you put them all in the basket now? Can you put them all in the blue basket?
Let's see, can you jump on? Let's see. Nice work. And none of them spilled out. Good work. All right, we'll put that over here. All right, Cooper, we get to play one more game. Are you ready? All right, so this time we're going to use different headphones. We're going to use this little headband, these little squishy earphones. Can you squish it for me? Squish it. Squish it like a pancake. Oh, good job. All right, these clip on your shoulders so that they don't fall all the way down to the ground. Are you
Okay,
ready?
masking's in that right side.
All right, we're going to clip it right here, just like that. And this one's going to clip way over here, just like that.
So cool, Cooper.
Wow, you look so strong.
Can you take them out now?
No, we have to leave them right there. And then these wiggle on the edge of your ear. Okay, are you ready? We're going to hear a whistle or a windy noise. It's going to sound like there it is. Oh, we got to leave it in.
Don't put your hands down, please.
You are doing it, Cooper.
All right.
Give me the headband.
And here's our headband.
I have it. I want to have it.
No.
I don't want to have it.
Should we take a break? Let's take a break.
Now let's show him the game first.
Okay.
All right. We leave it. Yep. Good job. Let's leave that one in. Should we take a break?
I'll be scared.
Hey, it's okay. Listen, they just gotta listen to your
Yeah.
ears.
We just gotta listen to your ear.
anything.
Cooper, check it out. Look at, I have one in my ear. Look at.
We may just get unmasked
Just
on.
like
But yeah,
that.
we'll see if we
Okay,
can't
if you
distract
wanna
him
play
enough
with
to get
ice cream, You
masked
gotta
on.
put the headphone on, okay?
Yep.
No, thank you.
I know. There we go.
Okay.
Let's do unmasked phone. Let's make sure
All
that
right,
we
let's
can get
take these
something.
out. We'll take them off for right now.
Yeah.
We'll take a break. They're gonna be right there. They're not on you. They're on the chair.
Yeah.
There you go. All right. So Cooper, we just have to wear the headband. Do you want to play with my ice creams or do you want to play with my stars?
Oh.
No.
Which one? Stars or ice cream?
No.
Hero. We gotta pick one. These ones? All right.
He is doing great. Man, we are working his sensory issues to the max.
All right. So my stars, we can build my stars or we can put my stars in the bucket. Do you want to build them really tall? All right, I thought so. So let's put this one, we're gonna put this one on the bottom. And then every time we hear our beeps, we get to stack it on top. What do you think?
Oh, but we're going to build a house.
I know, we can build a house after we hear our beeps. We've got all sorts of chords. We sure do.
Yeah, I think we're just gonna get unmasked bone and that will be enough to show.
All right, Mr. Cooper, are you ready for the headband?
We're coming in 2025.
Wear the headband, otherwise we can't play with the stars. Cooper, hey, buddy. It's gonna be okay. It's not gonna be so long at all. It's easy, very easy. But I know you can be brave. Do you need to go back and hang out with mommy for a minute? Should we take a break by mom? Come here. Go see mom for a second. We'll take a break.
I want my backpack.
Come here. We're not your backpack. Listen, I have something to tell you. If you're go ahead and wear that headband real quick and let her give you some sound, give you a lollipop when we get home. Any color you want. You want a lollipop when we get home? Yes. You can have green.
See if he would want a cushion, like a piece of foam. It might
I
make
know you
it better
guys
for
look
him.
great.
Say that we just want a cushion. He doesn't need it clearly, but
All right. Good job, Cooper. All right. So, do you want to put a cushion on your headband so that it's softer?
Yes.
Yeah, let's put a cushion on there.
Cushion.
It's a cushion. Watch.
Like a
Put it
pillow
just-
for your head.
It is. It's really soft and squishy.
Four, please.
See?
Ooh,
Can you squish it? See, that's squishy.
More, please, more.
Just
nice.
one pillow.
Yeah.
Okay. All right, careful. All right.
And just let him know we'll go fast, fast,
And we'll go
fast. We'll
really,
do
really
5
fast,
sounds
okay?
and then we'll be all
Every time
done.
we hear a sound, we'll make our tower bigger and bigger, and then you can make a house with them. How about that?
Oh, that sounds awesome.
All right. Get our first one started. Yep, just like that. Put it there. Good work. All right, can we scoot you close? Nice and close so you can reach. Very good. All right, here comes our headband and here comes our sound. Are you ready? Here we go.
No, you're fine. Leave it on.
It's okay. Listen.
Right there.
Fine. You're gonna be brave.
Yeah.
There it is. And a red one.
Here it is right now.
Listen
Go.
first.
Good. You got it. Changing frequency.
Ready? Here's the yellow one.
Big. Good.
Wow,
Coming
Cooper.
right down to a 0.
We haven't gotten a blue one yet.
We have to wait. We have
listen
to wait. 0. Good.
Yeah.
We're gonna do one more 0 and then 4K at 0. Good.
Connected there.
Look
Here's
how
one
well
more.
he's
Just-
wearing it. Here it is. Wait.
Oh,
Wait.
we gotta wait first.
Listen.
Yeah.
It's a
mhm.
sound.
There it is.
Here, 4K. We're gonna get one more just to show it.
Here's a orange or yellow.
How well he's wearing that.
Oh.
0. Or actually -10 for the 0. Here's the -5.
It's
Yeah.
a sound.
Yes, it is. I'm gonna get the 250 one more time out of 0.
Whoa, look at how
No, we can build a house.
Look how
And
good
a,
he's
and
wearing
a
that.
red one. Ready? Well, listen to our last sound. Listen close.
Listen.
Yep, right there.
There it
We
is.
have 0
You
bone
did
line.
it.
Build a house now.
Yeah. Oh, and we crashed. Nice work. And now, since you listen with your head, with the headband, you can have all the stars.
Oh my gosh, what do you say?
Thank you.
You are so welcome. All right.
Slight.
A
So, so we're at 25 and 20 in his left ear, 250 and 5, otherwise normal. We're at 20 and 15 in his right ear. You know, it's a slight conductive hearing loss.
Let
like
me
we
read over the
anticipate.
Tims to you.
Yeah.
On the left side.
Yeah.
We've got a 0.9,
2.9,
negative 141,
141,
0.3, and no width.
no width.
No width. It didn't finish the way it should have.
Okay, do you think that we need to do this again?
We can.
Okay, do you think that's our temp or do you think we need a better temp?
I think maybe it's our
He's so
temp.
much more tolerant right now.
All right. Let's see. Can you push that button right here?
Yes.
Push it right there.
He was consistent with his
Oh, push
SRT.
it one more time. Oh my gosh! Now we have to draw a new picture. Are you ready? Can you sit right here? Good
Yeah,
job.
why don't you
Daddy.
move to his left side and you'll see it better. Yeah,
Really
his right side was. Oh,
Ready?
moves away.
Can you put right there, push that one? Watch, it'll change colors. Oh my gosh, how cool is that? Yeah.
And just dial.
And you can turn that dial too.
Man, OT's gonna have a ball with this
Whoa.
boy. He needs some
That's
support.
pretty cool.
Yeah.
What's coming?
It's coming, yeah. And now it's in there. Good job.
I'm going this way.
Yeah.
Do.
Mr. Cooper, guess what? I have one more toy to show you.
You
But-
can give him something to hang on to. We've got lots
So,
of minutes.
We gotta take one more picture of your ears, and once we take that picture of your ears, I can give you.
Let's see, there's a turtle that he can go hang on to, or the squish. Oh, there you go.
Oh. All right, can I take a picture of your ears now?
Yeah.
This one here. Gotta hold real still.
There you go.
Good job. Can you tell me what colors are in there? Turn it on. Let's see. Can you push the button? Oh my gosh. What color's in the middle? Can you see? Is that blue?
Yeah.
Very cool. All right, we got to do this side. Are you ready? I see green.
Super.
Very good. 0.9.
Yeah.
Negative. Yeah, 150-ish.
Yeah.
0.3 and like a 125 width. Still
So
no
it's
width.
really, really wide. Okay,
Mhm.
that makes more sense.
And then on the right side, we've
Yeah.
got a 1.0.
Yep.
Negative 297.
Yep.
0.2 and no width.
0.2 and no width. Okay.
Very good. All right. So that last test there was looking at how his eardrums are functioning.
Okay.
And with that test, I'll open up the door so Sarah knows we're done. With that test, what we were doing is looking at if there's any fluid in the ears. I know that he's recently had that ear infection, so likely that is the case. And any congestion of that test. So did it still show an infection? So that test does not look for infection, but it does look for any fluid, I guess. Yeah, and fluid can be there and not infected.
Gotcha.
But I'm sure you've seen this diagram before, being that he's had ear infection, but this is where that ear infection is, right behind that tympanic membrane or that eardrum. So our ear canal builds up. This is that eardrum that stops that wax from going in here, and this is where we get those infections in the middle ear space. What we measure with this test is put a little puff of air in and we watch to see if that eardrum can move and how much it moves. So on both sides, we're getting some movement, but we're getting a lot of what we call negative ear pressure. So kind of like if you go up in an airplane, you feel like your ears just pop. That's that negative ear pressure.
Gotcha.
We can get that a lot with the ending or beginning of an ear.
Thing.
Recently had ear infection. That's probably what's causing our problems today. With that,
Only the rain. Only the rain.
as well. So that change in hearing we're seeing today is a slight lower pitch hearing loss that is isolated to this outer middle ear space.
Okay.
Because when we put that headband on, what we're doing is we're vibrating the bones that are right here, and that vibrates our inner ear, our organ of hearing.
Cooper, no more in
Organ
there.
of hearing. Can I show you the ice cream cones? We've got these ones here, and we've got all sorts of toys out here. And then, you want the bubble maker?
Yes.
How about the bubble maker? I think that'll do it. So, when we vibrate, it takes a minute. You gotta hold it. We vibrate that inner ear part. We're bypassing any of that fluid, any of that infection.
You get the bubble now?
Sometimes it just takes a minute. Let's see. Oh no! I don't think it's working today. Oh no. We bypass that to see how his organ of hearing is.
Yeah.
Organ of hearing is nice and tall.
More
So,
now.
the idea with testing that is to say that when that
fluid shows up when that infection is totally gone. All of that fluid is drained. That we hope that his hearing would return back to normal because his outer ear hearing would hear the same as his inner ear hearing.
Gotcha.
So we test that to make sure there's no permanent hearing loss, and there is no permanent hearing loss at the organ of hearing.
Good.
At the inside. So that looks nice and healthy today. He did a really great job tolerating all of our testing as well.
Did a good job.
So Sam, I know that he has a lot of sensory issues, but they actually endorsed drainage from his left ear. And that's what I'm curious about. If we have some external thing that's causing this difference in his left ear, since we're seeing pretty good eardrum movement. I know he's going to be a little bit of a challenge, but you've mastered him. I mean, like, it's just distraction. I think it'll be important for us to see, is there anything in that external ear canal?
And then Dr. Eckert was just talking to me through the little earpiece here. We said that our previous appointment has noticed some flu or some drainage from the ears.
Yes.
Has he had drainage from which ear?
Let's see.
What is there? There's some more.
We've got all the toys out, basically.
His right ear has traditionally been the worst.
Oh, the one.
Like our pediatrician will rank it like, 1 to 5. The right one is always worse. But the left one, I think, is the one that was worse this last time.
Okay.
And that's the one I saw drainage from most recently.
Okay.
But he'll get like blood coming out of it. Like it looks like blood and earwax mixed together.
Okay. I'll see if I can take a look too, but I'd love for you to be able to
And he
examine his
doesn't
ears.
stick in his ears, so it's not like
Okay. It's not like he's scratching. Okay.
we only use Q-tips like where we can see on the outer ears. So I didn't want to.
Yeah, we definitely don't want to be putting Q-tips in. Sometimes their ear canals are so tiny that can just push it further back.
Yeah.
I'm
So
sure
we-
you hear the same shit.
I know. So I don't because of his
Yeah, but anything you can see.
Right.
With like
So
a
like
wet
around the
washcloth,
opening when it was bloody, I just like used a wet Q-tip to kind of get all that
the dry.
out.
Yeah.
But yeah, I remember like right after his tube somewhere close to that, he was having like greenish, yellowy kind of drainage, but that hasn't happened.
Yeah.
In a while, and before it just happened with the bloody like earwax, that didn't happen for a while.
Yeah.
Okay.
Maybe over a year, where it was happening a lot the last time it happened.
Okay.
But this last time it happened, just
No.
one day he woke up
No.
and I noticed it like right in this part,
Okay.
and I cleaned it out and it never happened again. So.
I'm just wondering if we have, go right ahead. Just
We're both so yeah, so we were just kind of getting at if there's anything possibly in that left ear, because that left ear did show slightly more hearing loss on the right side, just very slightly, like the click of a dial, one click louder on the left side.
So the one this time was worse than the right, because I was expecting him to say the right because it's always been the right.
the right
But
was still the one that the pediatrician endorsed as red and inflamed with an ear infection. He did not endorse that from the left ear at the last visit,
I didn't know it changed colors.
but the history was that of drainage from the left ear.
Mr. Cooper, can we check your ears out next? Look at my flashlight. Can we look at the camel's ears? Check it out.
Look at the camel's ears.
Can you look at the doggy's ears for me? What's in there?
And
Mr.
you just
Cooper.
tell me if you would appreciate support.
Hey, come let her look in your
Can you
ears.
sit right here? Pull out the horse. Good job. And then you have a seat right here, and we'll take a peek in your ears, and then you can look at all the animals.
I'd love to see the left ear more than the right. If you have to choose.
Yeah, you can have a turn
Thank
if you
you.
want. All right, let's do this one way over here. All right, you want to do one and then I'll do yours? Let's see. Which ones do you want to look at?
The
The polar bear. Let's see. His ears look nice and clean. Check that one too. Oh, nice work. All right, Cooper's turn. Ready? Let's see. Oh my goodness. Yeah, lots of like dark wax.
That makes sense.
All right, which one do you want to check now? Whose ears need checked? What about his ears? He's got some really big ears. Oh, his look nice and clean. Let's check the other one. Nice and clean on that side too. Let's check Cooper's good work. Good job. Good job. Hang on, stay really still. Try flaky left. Otherwise, good.
Yeah, that goes along with the
Here,
autograph.
I check the rooster's ears. Where are his ears? His ears are on the side of his head. You can't really see his ears. Birds have funny ears.
Don't check her feathers.
Her feathers, let's see. How many feathers does she have? 1, 2, 3. Oh my gosh, she's got so many feathers.
About 6, 7, 8, 9.
So a
Is
little
that
bit of
the
that
tiger
darker wax on the
ear?
left side that looks more like wet wax.
Yes.
Almost. And on the right side, it just looks pretty dry in there. Like there hasn't been any recent drainage. So similar to what you've been saying. So we got ear history going on. I know you're being evaluated, all of us.
Yeah.
Which is so much fun.
Yeah.
We get to really talk about Cooper's success and where he can possibly improve. What are your other concerns with Cooper outside of his hearing?
He has been tantrum.
Okay.
And the more I'm sitting here and I'm wondering if his ears have just been bothering him, because when I was talking with the last people
You can open the door if you want, Cooper.
about when he started with the tantrum, is like when his tubes fell out.
Okay.
And I don't know. I mean, it could just all be coincidental, but
Right.
now I'm like kind of connecting dots here.
Come over here, look.
That maybe that's what it is.
Over
'Cause he was
there,
miserable.
Mom.
He
My
was
eyes over here the whole
rough in the
time.
beginning, like when he was
Can I take
baby,
a banana?
Yeah.
like colic
Do the
and
button?
reflux and
Yeah.
stuff.
Can I
And then
turn
he
it?
had all
You have
these
to
ear
turn it
infections,
slow,
and once he
one
got
at a
used
time,
to
no,
it,
slower,
you
slower.
know,
Be
like,
slow.
so much better.
Do you know what we get to
So
do?
now I'm wondering, like,
You know what we
Is he
should
just
do?
kind of in pain? Is that kind of his outward expression of that?
yeah,
When he
You're
is
such a
having an
good
ear
listener.
infection,
Those
is there
are for you
anything
to
that,
keep.
will he pull on them?
Those
Will
are
he
your
poke and get
prizes.
hurt?
no. And
Okay.
normally it's like,
Which
it's
one is this one?
other signs, like he'll get congestion.
That's the
And
edges.
What do you think? Should we race
there
it?
was a time I
Who's
took
the
my
fastest?
daughter
You
and
ready?
he
One,
always
two.
checks my phone, like, right?
Yeah.
And even though I'm not there for the other one,
Oh,
and
Cooper, did you
know,
see it?
the
Engine.
because of that, like,
Goes
Just
back and
incidentally.
yeah, no
Itchy is a bite.
signs at all. Like, it would always be something else. Like, it has gotten worse with
Ready?
Fred to his nose. And then we go in and it's, yeah, he doesn't really give me
Over the
any
top,
real
over the top. Just raise it.
Okay. Yeah, and so sometimes your kiddos can hold fluid that's not infected as
Over the
well.
top.
Yeah. And so when
On
we
the other
don't
side.
know, so for me, he has
Show.
negative 300 pressure essentially. That is a lot of pressure in your ears.
Rebecca.
Like when you're going up in an elevator, or
Don't
changing
have
elevation,
to
when you really want to pop your ears.
Don't
That's
have
kind of
to
where he's
edge
at right now. And that could be his baseline as well when he's in and out of all of these infections.
Yeah.
And that can be
loud. And I'm like, I wonder if,
I'm back.
like, this
You
is
are back. You got some
volume.
cars?
Yes.
Oh, look at that moves when it moves.
Like, I have to say,
Then
we talk lower all the time. But his sister is autistic.
Okay.
She talks loud.
And so it's kind of like the norm in the household.
Yeah. I have a headache all the time.
And you, Stacey, here is a lot.
Okay, I'm sorry. I'm like, is it
This
okay?
is exactly what
Okay.
you're supposed to be doing. It's okay. We've got every toy we've got.
I know, right?
Okay, yeah, very interesting. And sometimes when we're holding that chronic fluid, it can be uncomfortable and we just don't say it.
Yeah. He's gotten a lot better with his tantrums. Like, I had to take the phone away from him in the last appointment. I thought that they were just going to keep asking me questions, so I was trying to see the getting bored. So I was like, you can play a game. Well, then, like, 2 minutes later, I had to take it away. And that normally would have been a scream. And he's like, I want to play my game. I don't want to do that. You know, it turned into
able to like kind of talk through it instead. Okay.
Yeah. So, gosh.
What's up? Oh my gosh, you got 3 stickers?
Yes.
Wow, Dr. Eichert's really nice.
That is awesome. Good luck with that.
Yeah.
It's the best kid.
Oh my
Wearing
God.
earphones, doing ear exams, all
Check it
sorts
out.
of things that we
it moves on its own.
Hey, I'm just saying. He set limits and let us extend beyond those. Those were outstanding, right? When we just know that we get a little more time and some choices,
That's
right?
right.
Yeah.
All about choice.
It is all about choice.
Have you noticed that he's sensitive to loud sounds? Like, will he cover his ears for any certain
He
sounds?
covers his ears quicker than all of us do. I mean, obviously, sometimes things are just absurdly loud,
But you don't notice him covering his ears like when the refrigerator clicks on, when there's like random mundane sounds in the house. He's not like overly sensitive to sound.
no.
Okay, very good.
Watch this. Let's turn the lights down. What do you think?
Is he sensitive to any
Oh.
other like food texture?
Should we close the door? Does it
Oh,
glow?
he is
Close the door and it will glow.
terrible. He'll eat
Watch
fruit,
your fingers, sweet boy.
but he doesn't eat like cheese.
Good
or
job closing that
Okay.
door.
pasta.
A little bit picky.
Yeah, I know. It's such a
Yeah,
man of
let's shrink this
Yeah.
one. It's dark.
Pretty picky.
Yeah, do the lights.
If he
Whoa.
has
Those are
clothing
so
texture,
cool.
anything like that?
Very mildly. I would think it wouldn't be completely
part is
abnormal
Cooper's
for
favorite?
any other kid to be like.
I don't know.
Yeah,
or-
like
Open the
I
door.
get weird with some sweaters.
Exactly.
Some sweaters bother me.
Yes.
I get it.
Yes. So I don't think it's nothing I've ever worried about or
Okay.
thought.
All
And
matters,
OT is
right?
going to get way deep into all these
funny
questions
shit
as
in
well
the
as so will several
Yeah.
of the other providers. But as one of the first ones, I was kind of
Yeah.
curious see what I can bring to the table before
Absolutely.
everyone else.
Yeah,
sees you
nothing
guys,
I've
but-
ever.
Look
I
how
mean,
it
he is
turns.
kind of
You're
picky
talking,
about
people.
like
You have some good language,
clothing,
pal.
but I just think that's because he has a choice
How
of a
did you
voice.
do that?
He's like, this is what I want to wear.
And he's very bright. He's
Yeah.
letting us know his boundaries. and-
Yeah.
and letting us pass them. But
Right.
thank goodness. Did he pass his newborn hearing screening way back when?
Yes.
Good. Very good.
Hey, can you turn up the light?
Oh, there they go.
Look at the lights on.
Look
the
at how bright it
front.
is. I bet that if you ask really nicely, Miss Susan will show you what's on our TVs. Did you see that we have TVs in here? Whoa. What do you think's going to be on them?
Bluey!
Bluey. I don't think it's.
Hey, hey, Cooper. Hey, hey, Cooper. You're not looking. Who's over here? Sam picked these out just for you. She picked out the trains and the airplanes just for you. Hey, hey, Cooper, turn around. Check it out. There's more. We're so busy with the light in our shirt, we can't turn it. What do you say, Cooper? Turn around. Look at. There she is. Chirpy, chirpy. Ambulance. What else is going to happen? What is it? It's a train. Cooper had the light. He was showing me how the light turns on the table. And he used that all by himself, that it turns, right? It was really nice. Let's let the rest of the team hear this eval, though.
Yeah,
What else can I bring to the table when we all discuss them?
Yeah.
Because we're going to discuss them in length. But he did such a good job with
Yeah.
our evaluations.
We
Such a good
kind
job.
of started this process because his teacher has, said that he was having trouble at school, but I've realized in the past like 2 weeks or so that I think it might be, not that he doesn't have issues, because I know he
Right.
does, but I think the teacher is having like her own issues, because I've heard from other parents. So it's kind of, we don't know exactly what's going on at
Fair
school.
enough.
So you gonna put those back in the animal bucket?
Can we put, no, okay. So do you have any questions about our evaluations?
No.
Okay, very good. So I know that you guys are followed by ENC closely because of all the ear infections. And his evaluation today does line up with his history of ear infections. Just a little bit of a slight hearing loss in those lower pitches, which are the ones that are more likely to be.
Should we put them in the cleaner?
Fluid, things
Should we
like
get
that.
them clean?
Those lower pitches are where we would find
No, you gotta keep them.
like motor
Where are we gonna
sounds,
put 'em?
like the
Wanna put 'em
refrigerator
out here?
popping on. Our vowel sounds are there, so our really deep O, things like that. our higher pitched sounds like our F, S, where he's going to get clarity in speech, those are nice and low. Yeah. So we're not concerned with his access to speech right now. But just like you've been doing with ENT, just kind of monitoring those ear infections. If you notice a significant period of time where he's not responding the way he should be to sound, or you notice that maybe he's not understanding you the way he should, yeah, love to see him back. He's a pleasure. Yeah. I'm sure that there's probably audiology close to where your ENT is as well, so they can also see him back. Yeah. But otherwise, unless you have any other questions, we're all done. Yeah. And I think we're your last evaluation of the day, correct?
What's that? Yeah, I think so.
We had a differentiation between the chicken, the white chicken, and the brown chicken, the rooster.
Yeah, it is a rooster.
Speech language pathologist, I was just saying, that was awesome.
He loves to be specific.
Yes,
This chair is gonna trip someone.
we had a rooster and a chicken, and I never knew.
Hey Cooper, guess what?
Such a
We
delight.
can we can go home if we clean up the animals.
What is it? Is it the waddle that the rooster has?
Oh, yeah,
It has a
yeah.
waddle. I mean, the kids
I wouldn't have known what that was.
I've been with these animals for 15 years, and I've never said rooster. And typically, Cooper, I have an elaborate vocabulary, but silly me.
Oh, he was different. They do have a full name. I think we're putting all the animals in there. Is that what we're doing?
I guess
Yeah,
so.
okay.
Yeah, I think we're putting them on display.
Yeah, it's gonna be delightful, because that way they're closer to the sink and they all get cleaned up.
Exactly.
Really, I was
Oh,
so,
put
yeah,
that-
he's getting ready to clean up my toys.
Turn it off.
Oh, Lord.